Oh, it's on the wrong page. Good evening. It looks like we are on my personal page. So if you're watching, I'm going to shut down and go back to the Thinking Thursday page. I'm not sure well, just stay here and give me a moment to go to the Thinking Thursday page and let everybody know there's a switch up. Um, and I'm not sure why there's a switch up. So hold on just a second and I'm going to get that done right now.
Well, my children call this a plot twist
Yes, I love it. What a positive reframe.
because sometimes we do have a twist in life and it keeps us on our toes, keeps us humble of just when we think we've got it down pat. The world throws us a little kink or glitch and we have to adjust ourselves. And so this happens in life and it happens in science. It happens all over. So you're doing the right thing. You stay calm and persevere.
So I just did it because I don't know why it switched over. But we'll go from here because, as they say, it's all good.
Yeah.
So we are here tonight um, to talk about something that's near and dear to a lot of us, and that is shot or no shot. Do you take the COVID shot? Do you not take the COVID shot? What is it? I don't trust it. So many answers. And we're going to be joined by Yvette Cheeks, and she's going to help us sort some of that out because there's so much to sort out. But we always start off with some deep breathing. And before talking about this shot, I think we're going to need to breathe.
Yes.
So for those of you, it's your first time with us, here is what we do. You're going to breathe into the count of 4 and out to the count of 4. Listen to the pace I'm speaking, and it'll be slow, and that's how you're going to breathe in. Breathing in and just taking deep breaths has lots of positive qualities. It allows you to take more oxygen in, and your brain is getting more oxygen's flowing through your blood, and it allows everything to just calm down. And we may have all had stressful days or good days or bad days. I don't know. Either way, this process will allow you to just have that woosah moment and calm down and calm from the day. So, breathing with me, breathe in, 2, 3, 4, out, 2, 3, 4, in, 2, 3, 4, out, 3, 4. One more in, 2, 3, 4, out, 2. Hopefully we are there and we are a little calmer. And I know I'm there, and I see we have some on already. And thank you, Connector. I will keep calm and persevere. So good evening to all of you, and good evening, Sue. I see the comments, and I will be scrolling through the comments tonight to see what you have to say so that I can make sure I get your comments on. And I'm working through 2 screens so that I don't miss a thing. Well, as I said earlier, tonight we will be talking about the COVID shot. This is something that really impacts everybody who's listening. If you're live and you're anywhere in the world, you have heard of COVID. You
Yeah.
have in some way been impacted. If you have not known anyone who has had COVID, then you must be isolating very well, not even talking to anybody. It has impacted so many. I knew someone who passed away early on. So it's just been a part of everything. So tonight we're going to talk about the vaccine. I am not a medical professional, I'm a mental health professional, but the medical field, not mine. So I thought it best to invite someone on to help us through some of this. I became acquainted with Ms. Cheeks on another Zoom event, and she graciously agreed to talk with us tonight. She's a native of San Antonio, Texas, but as she says, she was born in San Antonio, but she moved to Houston when she was 6 months old. So really, she's a native Houstonian. You hear that long from 6 months old? Yeah, you're a Houstonian. She has numerous degrees. She has an associate's degree in nursing, and then she got her bachelor's at UTMB Galveston. Went on to Western Governors University with her master's of science in nursing education. So, and she's been a cardiac nurse. She's been an infusion nurse specializing in oncology cardiac patients. She's a private duty nurse. She has worked at Methodist Hospital. She has her own business. I'll let her tell you what that is. She's done too much to talk. If I read her whole bio and told you everything she did, I'd be here too long because she's too awesome and has done too much. I've said enough for you to know just how knowledgeable she is, that we have someone who we really can listen to and trust what she has to say. So, Yvette, how are you today?
I'm wonderful. Thank you for having me on. I'm honored to be a part of the community and answer the questions that our public has.
Awesome. So as we get started, we're going to dive right into it because believe it or not, 45 minutes goes so quickly.
Okay.
So and those of you who are in our listening audience, if you have a question, type it into the chat. I'll be able to see it and I will pass it on. But tonight I want to start with the basics because I'm an educator. So I believe in starting with the bases and making sure we all are starting on common ground and have the same understanding. So can you just tell me what is an immunization? You know, we hear the word and we know it's getting a shot, but can you really break it down and how immunizations work and what they do for us?
So immunizations are also synonymous with vaccines, prevent diseases that can be very dangerous to our bodies and sometimes even deadly. And it helps our body's natural defenses fight and safely develop immunity to disease. So it's hard to talk about vaccines or immunizations without talking about our body's immune system. All right, to understand how the body fights illness. When you think about germs such as bacteria and viruses, they invade the body, they attack us, and they multiply. This invasion is called infection, all right, and that can cause illness. So what the immune system does is use several tools to fight the infection. And in doing so, part of that is your red blood cells. We know those like you were talking about with your breathing and carrying oxygen, all right, to tissues and organs. They do their part. And then our white blood cells, which consist of lymphocytes, T lymphocytes, and macrophages. And we've heard some of that talk in the HIV world. You've probably heard of people's T cell count, all right? All of these portions of our immune system work to help us. And so when the first time a body encounters a germ, a bacteria, or a virus, it takes several days to multiply and before you actually feel sick, all right? The T lymphocytes are like your memory cells, and they remember that disease or germ or virus from before. And that way it can fight it when it's exposed to it again. So when we talk about vaccinations, we're talking about active immunity. We don't wait till we get smallpox. We vaccinate for that so we can prevent the actual disease because it has a high cost to our body and to our morbidity rate.
Ah, okay.
I know
Go on.
a
You
lot.
had a little glitch. Go on.
I said, I know that was a lot. So basically, the immunizations or vaccines help us develop immunity by imitating an infection. All right. It imitates it. So this type of imitation, though, doesn't cause actual illness. You may have what we think of as side effects: a sore arm, muscle aches, fever, a little chill. You just don't feel good. You're tired. Those are not side effects of the medication. They're your immune system doing its job, the wonderful job of fighting this invader, this foreign invader. Okay, so that's actually what's supposed to happen. So when it's doing that, your body is actually producing those memory cells, those T lymphocytes. All right. So we get those minor symptoms sometimes, but this is actually expected and normal, and to some extent good. It means that your body is doing its job.
Mm.
So all the vaccines or immunizations are doing is helping your body. So passive immunity is when you get the disease and you develop some immunity afterwards. And active immunity is when you get the vaccine and you develop immunity from that. And active immunity is the best. It usually lasts much longer than passive immunity. Plus, you didn't have to get sick.
Now let me make sure, I'm going to rephrase it
Mhm.
to make sure I understand and maybe make sure everyone else, because that's awesome about active and passive. So active immunity is when you take the shot
Yes,
and it mimics it in your system, as you say, and that's better for you because you aren't actually getting the symptoms in
disease.
the disease in your body. Passive immunity, you get the disease and you may have some immunity because you had the disease, but that's when you have to get sick. So
That's
if
right.
you take the shot, we will have active immunity.
That is correct.
Okay. Um, that's what I haven't heard of, active versus passive community immunity. So that is great. That does help to know that. Um, now here's another one. As I say, I'm big on vocabulary. Define immunity. We know that, okay, if I'm immune, I can't get it. Is that what immunity is? Because you've told us about two kinds.
Okay, so immunity basically means that you're not going to get severely ill. It does not promise you won't have anything at all. So sometimes you'll have had a vaccine, let's say it's the flu shot, and you still get the flu.
Mhm.
Several ways that can happen. First of all, remember it takes time to build this immunity. When you put it into your tissue and your muscle, you get a shot in your arm typically, it has to work through all of those phases. So it typically takes an escalating amount from a week to 2 weeks to have full immunity and protection from that vaccine. So you could have gotten exposed in between to someone that was sick. You could have already been sick and not had the symptoms yet. This happens actually quite a bit. So people say, oh, that shot made me sick. They were already sick. They just didn't have the symptoms yet. Like I was talking about your body's multiplying, the bacteria is multiplying in your body. So that's one of the ways that happens. And then the other thing that happens is that the virus or bacteria mutated a little bit, and so the vaccine wasn't perfect fits. Like when you're doing a puzzle, a jigsaw puzzle, and you go, oh, that piece looks like it goes here, but it doesn't quite fit. So your body responds by saying, this looks like a cousin to that I already seen to that bacteria, but I'm not quite sure. So I'm going to pull out the same stops and do the same thing. So you may have some symptoms or feel bad, maybe a day or two of not feeling good, but you don't get 2 weeks of illness. You don't end up with the pneumonia side effects from the flu or end up in the hospital. That's the difference.
So even if you get sick afterwards, it's all of that and you're better off.
And you're mildly sick. So when we
Mm.
talk about for example, the COVID-19 vaccine teaching, we teach our patients when they're in the chair that you have a certain percentage of protection, excuse me, after the first shot, and then a certain percentage of infection after the second shot from severe COVID. Doesn't mean at this time, we don't know the data yet, whether you could get asymptomatic COVID or even a very mild case. Case in
Mhm.
point, and I want to say in advance, this is not research, this is my clinic's population. So we've
Mhm.
given 500 first doses and are on our second doses. I have 3 patients that got COVID positive after their first vaccine. In all 3 of the cases, it was more than a week after the vaccine. Not one person was hospitalized. Matter of fact, 2 of them didn't know they were sick, and the other one had a slight headache and a slight cough. She says if it hadn't been for her job testing her, she wouldn't have thought to go in. She was so mildly ill. All of them have since tested negative and not had any other symptomology. That is a far cry from the people that are in the hospital one of my church members who's been on medications for 3 weeks and in and out the ER. This is not what you want. You want the
Right.
mild case or none.
Definitely, definitely. Since we're just talking about that, you talked a little about the side effects. Let's
Mhm.
talk about the difference between asymptomatic and asymptomatic and symptomatic. You know, you said that there
Yeah.
was someone in who took it and they didn't know they had it, and
Mhm.
so they were obviously asymptomatic, but give
They
us a little
tested
more
through their
understanding.
job. And
Mm-hmm.
so there's a lot of the employment places, they test randomly or they test weekly some of their personnel to get a barometer of what's going on inside their office or group. Depends on their exposure to the public and the other people, like a clinic, that kind of thing. But anyway,
Mm.
the asymptomatic means they didn't have any symptoms. And what was so surprising about that actually is all three people that I'm speaking of had high risk conditions. One of them has severe hypertension and diabetes, insulin dependent, and is obese. All right. The other one is also diabetic and hypertensive and elderly. We're talking all people that should have been really ill when we look at the picture of COVID in the past,
Right.
but yet they had mild to no symptoms. And that's what we would prefer. We don't have the data yet to whether our patients who have received their COVID vaccines can get COVID or not. But if they do, we think it will be the asymptomatic version. So we teach them to still mask to protect others who are not vaccinated, but that you will not get severely ill and be in the number that are in the hospital and dealing with long COVID.
So that is why we hear you should still wear a mask. I want to repeat and make sure I'm hearing it and make sure everyone gets it, because I think that's a major point that once you get vaccinated, you get the shot, especially if you're in that window between the first and the second, you could still get COVID. Even
Certainly.
after the second shot, you could have already had it, not know it, been asymptomatic. You could still get it. It won't be as severe,
Mhm.
but you could still pass it on to someone. And if they haven't had the shot, it could be severe for them. Is that correct?
You have enunciated it perfectly. Thank you.
And like I say, I'm, repeating it, making sure. So someone asks, well, do we know the long-term effects of the vaccine?
No, we do not. We have 8 months of data. That's as long as we have at this point. We are coming up on the 9th month, and so we will get more published data soon. When we get to 12 months of data, we will then, I say we, but the manufacturers will then be able to apply based on their results and the data for full FDA approval, instead of what we're under now is EUA, emergency use authorization, which gives us the abilities to give it because the risk of the disease is worse than what we know about the vaccines. But I think it will really help the public when they hear it's fully FDA approved. And I think that is coming really soon when we get just a couple more months of data. And as we gather the data from individuals who are even taking the vaccine, we utilize a system under the CDC that is called vSafe that pulls the data from that as well as for symptoms, side effects, etc. that you have. It checks in with you daily, and that data will also be used to help with that process.
Hmm. Now, someone is asking that do we the people who had the vaccination, was the mild to no symptoms possibly due to the vaccination? And that's what
That's
you
what
were
we
saying.
that's what we think. We don't
Mhm.
know that for sure, but that's surely what it implies. Because when you compare their comorbidities, the diseases that they had, being high risk, you would think that they would be much sicker than they were. Most of the people that have had mild to no symptoms have been healthy, young, and I'm not saying there aren't some outliers out there, but for the most part, people with high risk issues have had uh, much more severe illness, at least typically 3 to 4 weeks of really being sick.
And about do you know about how long these individuals were sick? Well, they had very mild symptoms. How long that even
I do.
lasted?
I actually know that the last one of the 3 tested positive, tested negative on yesterday. So they were sick less than a week. Or because
Mm,
you're following the CDC guidelines, you know, typically you quarantine for 2 weeks. But
mhm.
if you have no symptoms or your symptoms have abated, you can do 2 tests, and if they're negative and they're at least 3 days apart, you can stop your quarantine. So they're really turning around really fast. As a matter of fact, one of them that I spoke to this morning talked about how wonderful she felt. She actually felt like she hadn't been sick.
You know, you bring up another question. 10 days versus 14 days of quarantine. At first, it was 14 days. Now, you know, schools and some other places saying you only have to do 10. Can you tell us about that difference in days? That's confusing. All we know is it went from 14 to 10.
Yes, and sometimes 7. So let's talk
Mm,
about that. And it is more information on the cdc.gov, which is all the information I come from. I will always tell you if I'm talking about an opinion or an individual
mhm.
case. Other than that, I'm going with either the manufacturer guidelines or the cdc.gov. So under the CDC quarantine guidelines, they're looking at, first of all, did you test positive? Are you symptomatic, or were you in contact with someone positive? Then they look at how long you were in contact with that person and how many times. For example, in the classroom, were they sitting closer than the 6 feet for 5 or 10 minutes? Were they in the same classroom all day, but they were always more than 6 feet apart? There's several algorithms that you answer questions to when you're making these decisions. So it's not a easy answer to give you because it is complex and different and varied for each individual case.
Hmm.
It's almost
That
like writing old computer code where you have a stop and then go this way and go that way.
if then statements, if then this, yes.
Yes, that
So
exact.
when the schools are saying 10 days, and I guess that's why some are 14 in the classroom, it may be 14, but if you were this far, and that makes sense because I didn't understand that. Another question we're getting is how confident are we that the new strains are covered by the available vaccines?
So of the known variants, and I believe we are at 7 named variants at this time,
Mhm.
all of them have still the sticky spike that is very familiar to us on the pictures, okay? That is where the vaccine is working on that area. So as long as the variants have that spike, which is what attaches in the lungs and makes it so hard to get rid of, and especially the pulmonary area, the vaccines will still work. Now, as they mutate and make changes, we will eventually probably have to tweak the vaccine. The same thing happens with the flu in some years. So some years we'll have a flu. If you remember a few years ago, we had the swine flu. H1N3. So prior to that, we had a trivalent vaccine. That means it covered 3 different strains. It didn't cover every strain of the flu. It covered the 3 most virulent strains that were the hardest on our bodies. Then that year with the swine flu, they had to hurry and clone that one just like they did with these and take that DNA and add it into the vaccine. And we then had a quadrivalent, a 4 strain antigen in the vaccines. All right.
In one vaccine.
Exactly. So that's what you take currently. If you take the flu, you take the quadrivalent. The
Hmm.
trivalent isn't even available anymore. Why would you give somebody a shot that didn't cover all the serious strains? And so they sometimes get a strain that's a little different. In China and Asia, they have their flu season before us because of the geographics and the weather. So we're able to follow that and see which strains were the most common, they were the most serious, they ended up with hospitalizations, and then the pharmaceutical industry tweaks that vaccine to try and match that. So one year you may have gotten the same thing as the year before, you just boosted your immunity higher to protect you. And then the next year they had to tweak it and you had a different side effect because the vaccine was a little different.
I know we're talking about the COVID shot, but we've, been on the flu shot. There are people on who also are on the fence. No, I will never take a flu shot. Others, I always take a flu shot. Others, well, sometime I do and sometime I don't. Can
Uh,
you speak to that?
Certainly so. So when you're deciding whether or not you should take a vaccine, the first thing you look at is your risk factors. The biggest issue with the flu is that some percentage of people get pneumonia from it, and then they get severely ill and sometimes may die. Okay. Or if at the least, if they get pneumonia, they may then develop scar tissue, which then makes a problem for their morbidity and mortality rates as far as, they just don't have as much healthy lung tissue. And they even feel differently, like when you have asthma and you're short of breath. So the issue you got to look at is your personal health situation. And that's a discussion I really think that each individual needs to have with their PCP or primary care physician about what their risks are. Then you look at not only their age and their diagnosis and history, is how often they go out. Right now, you're quarantining. How you gonna get the flu? You can't get the COVID if you're at the house not doing anything and you're by yourself. So that might not be a big year that you have to worry about the flu because of that. And we're masking, which is something very different. Although I must say, the mask wearing, we're doing it so wrong that I'm surprised we're not sicker than we are. But
Can
anyway,
you speak to that? Do you have a mask handy to show us?
I actually do not. I am in my bedroom and I don't have a mask.
I know, and I didn't
I
bring one.
should.
Oh, I
I
have one
should.
right here. If
Okay.
you guys, let me make sure I don't trip on the cord. Those know me know that's possible. Hold on.
So while she's getting that, the one of the things I want to say about the mask is we're reusing them too much.
Oh,
We're
tell
keeping
us
them
about
too
that.
long. People are putting them on their steering wheel or their parking stick and
Uh-huh.
they just put it on to go inside the store like you're getting your ATM card. Okay. But it's not, you've spread the germs. If you had it, you just spread it inside your car. It's like wearing gloves in the store and then getting in your car and driving with it. You've just spread it everywhere. So
Someone back up because I'm taking this a little personal because I am one of those people who say I only use it for 5 minutes, so I use it again.
so you need a bag. You need
Okay.
a Ziploc bag or some kind of bag that you keep it in the car where it's not spreading things anywhere, and you can reuse them. They can even be washed. You could get like a sock, a stocking bag with the mesh
Mhm.
bags that you can, and you can wash the surgical mask. They will withstand washing 5 to 7 times on the CDC website. So you could even wash them, but you don't need to be leaving them in the car and just constantly putting that back on because you've now created a problem. So I can send a link out that we can add that on. You are putting it on correctly. All right. You really should only be touching the ties or the pieces that go over your ear. The front of the mask is considered contaminated. So after you put that on the first time, it is now forever. The front of that is dirty. So you've just
This
touched it with your
the outside even okay.
all of that is now dirty after you use it the first time. You're
So if I
only
take
supposed
it
to
off,
touch about that. You would have your bag handy and you would
and
put
would
that
it
in the
help to
bag.
fold it in so only the outside is
That would be great. And put it in your Ziploc bag or container and then keep it there. And so it's not exposing the rest of the car to the same. If you had it, you would definitely continue to spread it the way we do things. And it's a very
mm,
complicated piece. And I don't even want to get too far off track there, but in nursing school, we go to skills labs and get tested on what they call doffing and donning your PPE, your personal protective equipment.
mm-hmm.
They watch you tie your strings, put your mask on, the order, where you touch the gloves, on the inside of the gloves is clean, the outside is dirty. We do that, and sometimes it takes 6, 10 times for you to pass that test.
Wow.
And so you can imagine the average person in the public is not going to get that exactly correct.
Oh, and I see people wearing them, and I get up to you wearing it like this, where your
Because
nose is out. Well,
you're
that's
trying to
not good.
protect other people, but it's
Right.
bothering you. You're breathing the fibers, or it's
Mm-hmm. But
sensitive.
it has to cover nose and mouth.
to
correct?
protect you. The mouth
Hmm.
part is protecting the other person, but the nose
Hmm.
part is protecting you from them.
Oh
So
no, that
our,
see,
hmm?
I want to repeat that. Could you repeat that about the difference between the nose and the mouth? Could you say that
So
again?
if you're covering your mouth, you're protecting the other person from you,
Hmm.
but you're not protected yourself. You must cover your nose in order to protect yourself. So you're taking it
Mm.
in this way, your nose breather, okay?
Hmm.
And then so you need that intake to be filtered, which is what the mask is doing.
That's one I did not know. There's a lot I didn't know, but that one, at least why,
If
the
I
difference, one protects you, one protects the other. Awesome. I'm going to get to a few more questions because
please.
you're just a wealth of information. How confident are we that the new strands are covered by the vaccines available?
So that's what we were talking about, the mutations. We're
Hmm.
really confident of the named 7 mutations that we're aware of, that the vaccine is still working for those strains. And that's very good and helpful because the 2 newest strains, one in the US, one out of the, I believe, the UK, are
Hmm.
very strong in that they are more contagious. They are not making people sicker, but they're spreading quicker.
Now, should the shot um, impact those?
Yes, it will still impact that. And so the more people that take the vaccine, the less people that will get sick. And I don't know if you guys, because we've had such a busy schedule this week with inauguration, heard Dr. Fauci this morning talking about the numbers that were still getting diagnosed and looking at how contagious these new strains were,
Hmm.
of how fast we were going to get to 500,000 deaths and
Yes.
how quickly that's going to happen in the next month or so. I'm really concerned about what he's saying, and he I know he's not just making that up to scare us. He's preparing us for
Right.
a very dismal time ahead. So we need to continue the multi-pronged approach to vaccines, masking, hand washing, and everything else you can do. I use a UV sanitizer for my personal items like my phone, money, my cards, my pens. We have them at the office. We UV sanitize our clinic every night.
Now
So
back up. I'm going to stop you again because I know a little about UV sanitizers, and I'm sure my listeners do. But could you tell us a little about, because we don't even know where do you buy one that's real, is somebody, so can you tell us about how
certainly.
the UV sanitizer works and where we could get one if we wanted to?
So UV sanitation has been around for quite some time. We use that in the cosmetology world as well as in the medical field quite often. So this is just a step down from a clave that would, go at a high temperature and kill bacteria like they have in the hospitals for surgical instruments. So it is not as strong as that, but it would kill small amounts of bacteria. And we're not typically talking about something that has body fluids on it. So something that may just have a few particles of something, you touch something and didn't even realize it, then you touch your phone or your keys or the money or whatever it is. And so it can kill those small amounts. And so they have UV sanitizers that you can put your items in. You can get those even on an Amazon and those kind of things. They have fans that help blow the air, keep air circulating because one of the issues is stagnant air. Um, as well as I think that all of these, again, are multi-pronged approaches depending on the setting you're in. That might not be something you need if you're just in your own home and you're, staying in the majority of the time. But if one of your family members is going out, they're an essential worker, they're healthcare personnel, these are some things you might want to invest in for those kind of situations. So everybody that has a little anxiety and a little OCD, don't go buy UV sanitizer. I'm talking about your more high risk situations.
What about the oxidizer you use for your CPAP to clean things? Does that have any impact on cleaning these items?
That is a good question. I actually don't know the answer to. I will have to find out some research on that particular one.
Okay.
Okay.
Lots of questions here, and I'm going back so to see the ones I missed. Are we confident that, well, we talked about that the new strands,
Will be covered.
will
At
be
this
covered?
time, yes. And
Um,
if we get to a mutation that it's not covered, they will
mhm.
tweak the vaccine and we'll have to take a booster.
And why do we need two?
So with the first shot, like many vaccines, they give you some immunity. And then
Mhm.
you have to wait a period of time and then you boost it higher up. So they do this in the testing phase, the clinical trials, to see how do we get to the highest level of immunity. So typically, and I'll be honest with you, I would have been excited if the vaccines had had 70% immunity. So to say that we got to 95% is just fantastic. All right. That doesn't happen with many shots. Maybe the tetanus or your Tdap that is so protective that you even get tetanus protection within 2 to 3 days afterwards. So you cut your foot on a nail, you clean, and then you think, you know what? I haven't had a tetanus shot in a long time. Maybe I ought to go in, and you think about it a day or two. That third day, you're still protected from tetanus because of how strong an immunity response that tetanus vaccine gives us. And so some vaccines can do that in one shot, but most of them take a series. If we gave a larger dose, it may be protective for a short while, but not hold the immunity. So your goal
Mhm.
is to not only get full immunity, but to hold it. And we're really hoping that we get at least 2 years out of this shot and we don't have to do it every year. It would be wonderful if it's longer. Like the pneumonia shot, it's 5 years.
Awesome. And the pneumonia shot, you take that over at what age? Isn't there like a
So definitely over 65, and then other populations that are high risk. For example, Down syndrome people
hmm,
usually have respiratory issues. And so they're at a little higher risk. Somebody with asthma would be another example. So some reason that you're at a little higher risk, you may do earlier. We even do some children like preemies. We would give them a pneumonia shot during their normal series once they're
really?
taking vaccines, because they sometimes don't get vaccines on time, but when they do get them, because their lungs are underdeveloped, maybe they were on a ventilator, something that happened. They may look perfectly normal on the outside, but if you do a pulmonary function test and some of those studies to check their lungs, they're not at the same capacity that a normal delivery child would have been. So there are things like that that can put you at higher risk where your doctor says you might want to consider getting a pneumonia shot for these reasons.
Awesome. We have so many questions to get to. Let me get to a few more. Can you speak to the importance of Blacks participating in clinical trials?
Oh, I would love to talk about that. So we know there's some distrust with the healthcare system, and rightly so, based on the history. I won't even say of just this country, but all over the world, where poor people, not just Black and brown, but poor people in general, have been utilized as test subjects and dummies. I would even say, I hate to say this, but on live air, but it's just my truth, that I think to some extent our military can
Oh,
be subject to being required to do something under the name of we need to protect you from every hazard, but we haven't fully studied this completely yet. So they get a lot of the vaccines on the front lines for us because they're at such high risk when they're out fighting to every hazard known to man, including
right.
chemical. So warfare. And so that happens to them as well. But it is so important because we need the data on what's different about us. If we're having different side effects, if there's populations we shouldn't vaccinate. And this is one of the wonderful things I think the CDC has done right out of this whole situation is they created that V-Safe program I was alluding to earlier, where we register you and your vaccine administration, and it checks in with you, because that data also gives us live time information clinically. We have webinars twice a week that tells us people that are having problems, issues that we're seeing, whether it's a lot number, whether it's a temperature issue, whatever the problem is, they're investigating, they're being transparent with us on the webinar and giving us that information so we can make decisions with our patients about who should wait. For example, I had a young lady the other day who I've known since birth, and she's always had a lot of allergy problems. berries, Chinese food, this, that, and the other. And she really wanted to take the vaccine because people in her department were getting ill. And I told her, I said, I would not recommend it. Matter of fact, I wouldn't do it unless your doctor wrote an order. And yes, we have epi but we don't want to have to do all of that.
Mhm.
And she's such a high risk for allergic responses that I think it's a better thing for her to be more cognizant and cautious and just hold out, and maybe everybody around her get the vaccine, and we can give her body a little bit more time to figure it out.
Mm.
So there are
Wow.
people that should wait. Another example would be if you've had a vaccine reaction before to any vaccine. If you fainted, if you had a seizure, you had to go to the hospital, anything like that from any vaccine ever. You got Guillain-Barré, you had Bell's palsy, all of these kind of things that have rarely happened, but have happened and may be connected to a vaccine, then this person should not be a person that's standing in line right now to get a vaccine. We need to wait on them.
Good point. Two more questions, and I'm going to wrap some together, but one that stands out alone is, what about, there's something about putting coconut oil in your nose? I guess as a protectant. Do you know anything about that?
Okay, so let's talk about the protective mechanisms of your body. One of your protective mechanisms in your body from invaders is intact skin, outside and internally. So sometimes especially in this time of year where the weather's dry or maybe the office building you're in has the air conditioner going all day, your nose dries out. So then that spot may be open, it may bleed, and it gets irritated. You have problems, you may even feel it burning or something like that. So the coconut oil is one of the natural holistic type things you can do to keep that area lubricated from being very dry. So it's surely, one of the choices you could use. In the old days, we used Vaseline. So all of those things can be helpful, but I do want to caution you that you don't pour it down, that you don't use large amounts, because if you get that into your respiratory system, you can actually develop a very serious type of pneumonia from the oil. Okay, if you get an oil pocket, it keeps the alveoli from expanding and opening so you never pour anything down your nose. Okay.
Good point. Now, some questions wanting to make sure people understand. You were talking about this should last for 2 years and we don't know. They're saying, is she saying the vaccine will have to be taken every year, like the flu? If so, how do they know this is necessary since it hadn't been long-term data?
We don't know.
Okay.
We don't know the answer. We won't know until the time gets there. This pandemic is the greatest example of something we've all heard, a phrase about medicine. They say they're practicing medicine. So we are learning day by day. And I think that what we've got to get right in healthcare is being totally transparent and open, that there are many things we do not know the answer to yet and will not know until the day that happens. In your life, you make decisions and you say, oh, I would never do that. But that may not occur because you weren't in that situation yet. But now, fast forward, now you're in that situation, you may make the same decision, whether it's good or bad. So we don't know the full answers to that length of period. I'm just talking about possibilities based on previous vaccines, like the hepatitis B is a 3-shot series. You take that once and you typically don't need it again. But healthcare workers who are high risk for Hep B because they get exposed to people's blood have to have their immunity checked through a blood test called titers, which looks for the antibodies, okay? We have one for that for COVID too. So when they test them, when they're in school, when they're working in that healthcare environment, every so many years, sometimes their titer immunity has waned or gone down. And then they have to do what? Take a booster shot. So that may be 5 years, it may be 10 years, and it's very different from person to person. If we knew and it was the same for everybody, we just say all healthcare workers need to take it this year. But it doesn't happen that way. There are variances in our bodies.
Oh no, you froze. You froze on my
Okay,
end.
am I back?
Okay, you're back now.
Okay, I feel okay.
Okay. um, Last question, possibly. We know that you can get it twice. That's been proven. Is it typically worse the second time, or is there any? What? Just tell us about getting it more than once. Who knows?
So
Maybe you get it three
what
times. We don't know.
well, there's a lot that we don't know, but of the cases where people have gotten more once, it was typically a person who had a very mild case initially, and then they get re-exposed. So we don't know whether they are exposed to a more virulent form of it, or whether that re-exposure, the body is fighting harder, and then your immune system creates a bit of an issue trying to fight this off and create some of the symptoms as well. The answer is we just don't know.
Mhm.
We also look at things like false positives in tests, especially if the person was not symptomatic. Um, and when they came out with those first rapid tests, that we were
Right.
having some false positives and false negatives. So the PCR is still the most effective test, which
Now,
is
which one is that?
that's the one where we take the uh,
The swab.
down the nose. Yeah, it's that uncomfortable one.
The
That is
one
still
everyone tries to avoid.
yes. It's like the difference between having a pregnancy test and having the little urine on the stick versus going getting the full test at the doctor's office. There's going to be some range where it may not show up. Maybe you were in a window, maybe the count wasn't up. So bacteria and viruses have something called colony counts. If you think about it like an ant bed, how big and how big the colony is. So sometimes when it's a small amount, a small mound per se, you may not have test positive yet. So then a day or two later, this happens even with other diseases. You may have went to a rheumatologist and they tested you for lupus and MS and all of this stuff, and everything was negative. Then you keep having problems, and 6 months later, you may be at another doctor and they do the test and aha, it's positive now. They didn't necessarily miss it. It just wasn't evident enough that the test picked it up.
Wow. We have maxed out on our time.
Oh,
And
wow.
I told you it would go quick
We-
because it's so much information. So to my audience, I want to say that Miss Cheeks and I have talked about her being a monthly contributor to the show because there's so many other, we're talking about COVID because it's here and now, but there's so many other health concerns such as diabetes in our community that we need to talk about and have people understand. Just so many things, healthy diet. We've talked about so many things. So we want to, she's going to be back in February. Probably the third Thursday is going to be her time to come back. She and I have talked because I think it'll be very beneficial. Our health, as I say, mental health is just part of our whole well being. When we address one part of our health, we impact the others in a positive way. So I want to thank you so much for coming on and sharing. And we had numerous comments. So we know we're up to like 43 comments. So we know that this is something that we needed information on. And I really appreciate you sharing this. And as we close out, I also like to give you your call to action. And my first point is you make the decision for yourself about this shot. Don't listen to others. Talk to your doctor, pray, but you make your own decision. It's a
I agree.
personal decision, and don't let anyone else's thoughts really impact you. It could be that you don't want to get it because everybody's saying no over here, everybody's saying yes. Talk to your doctor. It's a heart decision. It's something you have to do for yourself. So make that's number one. Number two, I still say in this time of COVID, there are people who are still alone at home. Reach out, call, ring their doorbell, and stand back and say hello. There are people who are borderline agoraphobic, and now they're scared to go out. I've seen it in my practice. I've seen it It's just not good. And the last point, remember, mask up. Mask up appropriately. If you reuse a mask, now I'll add, thanks to Yvette, if you reuse a mask, put it in the Ziploc bag in your car. Don't just hang it on the gear shift like I've done. Mask up because wearing is caring. And remember, all health is mental health is just health. So take care of your mental health and take care of yourself. We'll see you next Thursday, and I will post on which page how to find us. I'm still working the kinks out on that, but I'm so glad you found us. Also, share this on your page. This is information that is beneficial to so many people. So once it's off, you can click right under the video, you'll see the share button. Share it, let others get this information. If you know people who you want to have this information and they're not on Facebook, they can go to Thinking Thursday with Bronwyn on YouTube, and it will be there tomorrow morning. See you next week, and take care of your mental health and take care of your health. Thanks again, Ms. Cheeks.
Thank you.